Hi, Dr. Frank Johnson from Sport Medicine Ultrasound Canada. I'm going to show you how to scan the hip joint. So the patient position is going to be supine. The landmark is going to be the femur. The orientation of the probe is going to be short axis or cross section on the femur. And then the movements of the probe are going to be towards the head. So we're going to slide the probe away from the curved portion of the femur. As soon as the femur starts to flatten out, we're going to angle the medial side of the probe up towards the umbilicus. And then make some slight angulations of the probe to make sure that we have the femoral head and the femoral neck that are nice and bright. And you can very clearly see how the femoral head is high on one side of the screen and then drops down to the femoral neck. And the area of interest is going to be the capsular ligaments that sit on top. For an injection, for example, we're going to land our needle right here at the junction between the femoral head and the femoral neck. And that's how we scan the hip joint. I'm going to show you how to scan and inject a hip joint. The most important thing is to have your patient supine with the leg in a naturally lying position. We don't need to worry about internal or external rotation just yet. The next most important thing is I need to be able to see the anterior superior iliac spine completely exposed from the bottom up. So you need to ask your patient's help. Dr. Del Duca, could you help me expose this part of your leg all the way up to the ASIS? Very good. And lots of times you just get your patient to help you by holding the shorts this way and relax back. I can now see my ASIS. I can now begin the procedure. A little bit of gel here. My landmark is going to be the femur. The orientation of the probe is going to be short axis on the femur. I'm now going to slide the probe proximally until I see the femur start to flatten out a bit, like so. And then I angle the probe just slightly, the medial edge of the probe just slightly towards the pubic symphysis. And I can now see the curved head of the femur here. And the target for injection is going to be where the femoral head drops off. It's called the head-neck junction. My needle angle of entry is going to be right about here, in plane with the probe, dropping it right down to where the yellow needle tip is. The needle, forgive me, the yellow arrow tip. So that's how I scan and inject the hip joint.